Hello and welcome to my presentation for the University of Victoria's School of Public Health and Social Policy, the PHSP Culminating Conference. My name is Simone Page. I use she, her pronouns. During my presentation today, I'm going to start by acknowledging the land where I've been living and learning during my program. I'll discuss a summary of my practicum and my role there, the resources I created, the training I received, and how all of that relates to the PHSP values and knowledge areas. And then I'll go on to talk about the call to action that I chose to operationalize during my practicum, the key insights I gained, and the gratitude I have for all those who helped get me here. So I want to start off today by acknowledging that I give this presentation as a settler living and working on the unceded lands of the Tk'emlúps te Secwepemc, the people of the confluence. Although my education is online, I have also lived and learned on the unceded traditional territories of the Lekwungen peoples, the Songhees, Esquimalt, and Wasanich First Nation. I was fortunate to obtain a practicum placement with the First Nations Health Authority, FNHA. I wanted to work for FNHA because I want to support First Nations-led public health solutions. During my practicum, I worked with a team of nurse practice consultants for the interior region of FNHA. The NPCs represent the 7 nations of the interior region, the Deqaldine, Kootenai, and Tla'aqueçon, Secwepemc, St'át'imc, Syilx, and Chilcotin peoples, representing over 50 communities and more than 27,000 First Nations members. During my practicum, I collaborated with the 4 Directions Mental Health and Substance Use Team, the Toxic Drug Response Team, and the Public Health Emergency Response Team. I utilized the PHSP skill of interprofessional practice and supporting organizations and communities to advocate for and advance their public health priorities. Through this collaboration, we identified resources I could create to support them in their work. So these are some slides of some of the resources I created. The first resource I created is a training guide designed to support nurses who are new to communities where community members are dealing with alcohol use disorder. For this guide, I synthesized information from the BCCSU and UBC to provide nurses with resources for themselves and community members. The second resource I created was a COVID-19 poster to provide up-to-date and culturally safe information to stop the spread of COVID-19. These 3 slides are just a few slides from that are examples of posters that I worked on with the 4 Directions and Public Health Emergency Response Team, which advise people how to avoid the harms associated with drug use. These posters were part of a wider project which included a booklet intended to educate about the path to substance use. It included statements from peers as well as an approach to harm reduction called Blending Medicines, created by the 4 Directions team, who seek to incorporate First Nations worldviews on connection and community into their clinical harm reduction resources. I was also really fortunate to receive a lot of amazing training opportunities during my practicum. One was the Not Just Naloxone training, a 2-day intensive course which delved into the history and relationship between colonialism, policy, law, intergenerational trauma, harm reduction, and evidence-based practice. The second was a course entitled Into Worlds Trauma-Sensitive Care Course, a 1-day intensive course designed to relate the concepts of cultural competence, cultural safety, and cultural humility to all aspects of healthcare provision and public health policy. This course also included coaching and interpersonal interactions, which I found to be very meaningful and helpful. In this course, we explored concepts of intergenerational trauma and the importance of access to equitable trauma-informed care. And then throughout the duration of my practicum, I worked on the Sanya's cultural safety and humility training. This training explores the history of Indigenous peoples in Canada in relation to colonization and discuss these impacts on the health of Indigenous peoples. It also provided education around cultural safety in healthcare and health policy. So during my practicum, I was able to operationalize the PHSP values of improving health and reducing health inequities in community, interprofessional and multidisciplinary approaches to practice and research, and diversity and cultural safety. A recent report released by FNHA and their chief medical officer highlighted the impact of the toxic drug crisis. Between 2019 and 2021, life expectancy for First Nations people dropped by 5.1 years, with the largest impact coming from the deaths related to the toxic drug supply. That's not just a statistic, that is a call to action in and of itself, and definitely invokes a lot of grief. This loss of typically younger lives is why I have chosen to use harm reduction practices to improve and reduce health inequities for people affected by the toxic drug crisis. Through engaging in interprofessional practice with the aforementioned teams, I was able to create resources which integrated the principles of cultural safety and humility, and which seek to keep people who use drugs safe from harm. The PHSP knowledge areas I was able to incorporate into my practicum were effective multidisciplinary teamwork. During my practicum, it was apparent that collaboration is required to make the intersectoral changes needed to address the toxic drug crisis and improve health outcomes. The other was the social and life course determinants of health, addressing the conditions necessary for life in all aspects of public health through the provision of culturally safe care can help to uproot systemic racism and thereby decolonize these institutions. And the third was improving health and reducing health inequities in communities, as I spoke about in the last slide. Working with FNHA to rectify health disparities on all fronts, but especially in the area of harm reduction in light of the ongoing crisis, has felt very meaningful. The call to action that I chose to focus on throughout my practicum and program was the 19th call to action of the Truth and Reconciliation Commission, which states that the status of Indigenous health in Canada is a direct result of government policies and calls for the recognition and implementation of the healthcare rights of Indigenous peoples, as enshrined in international law, constitutional law, and through the treaties. This call is important for myself as a future public health practitioner, because to address the health disparities faced by Indigenous communities, an intersectoral approach to reconciliation must be promoted in all aspects of our work. Applying a public health lens to policy concerning health promotion and harm reduction services would be a path forward that could address some of the root causes of these inequities. The detrimental impacts of settler colonialism have often been enacted through formation of policies purported to be in the service of improving public health. This is why it's especially important now that public health be used as a powerful tool to restore health equity to Indigenous people, colonization, and culturally competent service provision. This is why call to action number 19 is the one that I have been incorporating in my practicum, and I will be guided by in any future work that I do. So the key insight of the PHSP program would be the interplay between the social, political, intersectoral, historical, and contemporary issues that affect public health. It's very complicated. Understanding the role of historical and political factors in health outcomes clarifies how health disparities are a result of existing power structures and systems, which I believe can be transformed through the work of health advocacy. The most meaningful thing I learned in my program and my practicum is that there's already so much incredible work underway to address the issues faced by the public health sector, and that I only need to join in to begin to make a difference. I want to say a huge thank you to Brittany and Catherine, my practicum advisors, to my professors, my family and my partner, my support network, and mostly to the land, which sustains us and makes all of this possible.